Hello, I'm Dr. Saeed Danishman. I'm a fertility specialist here at San Diego Fertility Center, and for the last 23 years, I've been taking care of many egg donors whose generosity and commitment to creating families has helped many patients, many intended parents from all around the world achieve their goal of having their families. So what I wanted to do today was talk to you a little bit about the diagnostic testing that we perform in order to make sure that the process is safe for you and also for the pregnancies that are achieved. The first step of the process is to getting to know you better and also getting to know your medical history better. So what we do is we have a conversation either in person or by video. And during the consultation, what we do is we review your medical history. We want to know your age, your height, your weight. What we want to do is we want to make sure that you have regular cycles, regular periods, and if you don't, whether you're on a birth control pill or any other type of contraceptive method. We also want to make sure if you've had any significant past medical or surgical histories, if you're taking any medications. And one of the other aspects of the medical history that are really important is your family and genetic history. In other words, in your family, in your parents, in your grandparents, are there any potential medical illnesses or genetic illnesses that potentially could have a risk of transmission to the eggs and potentially to the offspring that you help create? That's the initial medical history. Subsequently, we see you in our office and we do a general physical exam. We get your height and weight, your blood pressure, your pulse. We do a general exam, heart, lung, breast examination, and we perform an ultrasound. Now, the ultrasound is part of what we call ovarian reserve testing. What we're trying to do is to understand about the pool and the total number of eggs in the ovaries. We call that the antral follicle count. Every egg, every immature egg, resides in an immature cyst or a small cyst called a follicle. So during your vaginal ultrasound, what we're doing is we're assessing the ovaries and we're taking a look and we're numbering these particular follicles. We expect roughly about 10 to 12 immature follicles on each ovary. That's not the total number of eggs you have in the ovaries, but that's the number of eggs you have for that month. And what it does, it gives us an idea of potentially the total number of eggs we're going to be retrieving from you during the stimulation cycle. Now remember that in a menstrual cycle, every month, if you're not on a birth control pill or a contraceptive that prevents ovulation, every month one immature egg develops to maturity over the course of about 10 to 14 days. Every egg develops in a little cyst called a follicle. That follicle grows. And during the time when you're going through the IVF cycle, you're taking hormonal medications, FSH and LH, which are the same hormones that your brain produces. And what they do is they stimulate the ovaries to mature and develop eggs. So when you're coming to the office, what we're doing was measuring those follicle diameters in order to gain an assessment of the maturity of the eggs. Now we'll talk about that in another part of the video. In regards to diagnostic testing, after the ultrasound, what we want to do is we want to do some blood work. So blood work for example, thyroid, blood count, blood type. We also do a urine test for toxicology for drugs and medications. We also do a blood test for what we call genetic recessive mutation carrier screen. We want to see if you carry any genetic recessive mutations because we want to ensure genetic compatibility with the patients that you're donating eggs to. For example, we're testing for genetic recessive mutations such as cystic fibrosis, thalassemia, biotinidase deficiency. That's to ensure genetic compatibility. We also want to have you meet with our certified genetic counselor. The genetic counselor reviews your family history, reviews your genetic history, and identifies any potential medical problems which could have a genetic basis, which again could increase the risk of transmission of those genetic diseases to the eggs and to the newborns. The other factor is we want to also assess your psychological health. So we have you meet with a psychologist. These days, psychologists can meet via Zoom or video consultation, and they're going to review your psychological history and make an assessment to ensure mental and psychological health. During the process of diagnostic testing, you're going to learn a lot more information about your medical history, about testing, about your ovarian reserve, essentially the number and the quality of the eggs in the ovaries. So this is a great time to kind of reassess or assess your own health. And we're always available to you to give you feedback and give you all the information that you need so that you feel comfortable and confident moving forward with the egg donation process. Thank you. What I wanted to do is speak to you about a certain aspect of the egg donation or IVF cycle, the in vitro fertilization cycle, and that's about side effects and risks. So as you know, in order to perform the IVF cycle and stimulate the ovaries to retrieve eggs, what we need to do is use medications. Now, these medications are hormones, and they're the same hormones that your pituitary secretes every month to stimulate the ovaries to mature and develop an egg. These hormones are FSH and LH, and every month, if you're not on a birth control pill, the brain secretes low levels of these hormones to mature and develop an egg in the ovaries. Now, each egg, as you know, develops in a little cyst called a follicle. That follicle is typically about 4 to 8 millimeters in size initially, and under the influence of these medications, it develops and grows into about 18 to 24 millimeters over the course of about 10 to 12 days. So what we do during the IVF cycle is we have you monitored via ultrasound and blood test to determine the size of the follicles, the diameter of these follicles, and the number. Once those follicles get to a certain diameter, we know the eggs inside those follicles are mature, and that's a signal to us that the eggs are ready to be retrieved. Now, what are some of the side effects that you'll feel during the IVF cycle? Because you're going to have multiple follicles developing in your ovaries, the estrogen levels increase because each egg produces a certain amount of estrogen. So some of the side effects of those particular hormones could be, in particular estrogen, could be breast tenderness, occasional headaches. You may feel some general sense of fatigue. And because multiple follicles are forming within your ovaries, you may actually feel bloated. You may even have some soreness, some pelvic soreness. Once the eggs become mature, we give you a final injection to cause the final maturation of the eggs in the ovaries. And then what we do is we retrieve the eggs under anesthesia. You're asleep for about 20 minutes. It's typically a brief general anesthetic. Some clinics will use intravenous sedation, in other words, medications that are given intravenously to give you sort of that twilight sleep for somewhere around 20 minutes, which is the duration of the egg retrieval. Now, of course, the egg retrieval can last longer or shorter depending on the number of follicles you have. So the higher the number of follicles, the potential longer duration of the egg retrieval procedure. In the egg retrieval procedure, an ultrasound probe is inserted in the vaginal cavity, which has a guide through which a needle is inserted, and that needle pokes through goes through the back of the vaginal wall into the ovaries. And the needle is under ultrasound guidance, enters each one of those follicles or cysts and aspirates and withdraws the fluid from those particular follicles. So we do that on every follicle on both sides with the two ovaries. Once the procedure is finished, you go from the operating room to the recovery room, and you recover over the next 1 hour, where you'll be more alert. But as you wake up, you may have some pelvic cramping, you may have some pelvic soreness, you may feel bloated, and that bloating sensation may last for up to a week or even 2 weeks because those ovaries need to then shrink back to normal size. The ovaries are inflamed, they're enlarged after the egg retrieval procedure, and that's the bloating sensation that you may feel. Ovarian hyperstimulation syndrome is a potential complication from IVF, from the stimulation of the ovaries. Now, over the series of many years, we published many papers utilizing a particular technique, and we discovered a technique utilizing your own body, your own pituitary hormone, natural hormone called LH, in order to cause the final maturation of the eggs. When we use that medication, which is called a GnRH agonist or Lupron trigger, then ovarian hyperstimulation is prevented from forming. HCG is also a hormone that we can use to cause that final maturation of the egg, and HCG is really the culprit that can cause hyperstimulation syndrome in a select group of egg donors or patients who produce a very high number of eggs. So make sure you speak to your physician and doctor about the trigger mechanism and how to avoid hyperstimulation syndrome. We really don't see hyperstimulation syndrome anymore, but if it does occur, it can increase the level of fluid inside your abdomen. You can feel uncomfortable. You can have even some sort of respiratory distress, not being able to take deep breaths. And in very severe cases of ovarian hyperstimulation syndrome, there could even be blood clots within the veins or within the blood vessels. So again, in very severe cases, patients can even get hospitalized, but we don't see that anymore if we use the techniques that we published on in regards to the papers that we published. The other potential risks are the risks during the procedure itself. There's always a risk of bleeding, there's a risk of infection, potential injury to internal organs. Thankfully, these are not very high risk and rarely occur. And again, the experience of your fertility physician, your fertility specialist goes a long way in preventing many of these, all these risks from occurring.
Hi, I'm Abigail Glass. I'm a marriage and family therapist practicing privately for the past 20 plus years and working in the field of advanced reproductive technology for the past 15. As a donor, one of the first appointments you will make is with a mental health professional. That will be your psychological evaluation. This is an invaluable meeting to have. We'll cover all different parts of your history, as well as ideas and thoughts you have about the future. The therapist will ask a lot of interesting questions, and it's also a time to get education about the process you're about to go through, as well as formulate your ideas and thoughts about passing on your genetic material. We'll ask questions about your family, their medical and psychological history, as well as about your relationships with those family members, all the way through your maternal and paternal grandparents. Sometimes we may ask you a question that you've never even thought of inquiring about. That's okay. You can always go after the session, collect some more information, and then come back to us with it. We're going to go over what's going to go on with you in the present, as well as what's going to happen with your body in this process, and also ideas about the future. You'll also take a personality test. In this test, there will be several hundred questions, and there's two forms of this test. There's two different scales. One is a true-false scale, and one is a scale where it's on the realm of going from very true, somewhat true, all the way to disagree and strongly disagree. On this test, we want you to be a real person. We don't want you to be perfect. So you'll just take your time, go through it, and be truthful. This psychological evaluation, this session, is all about you. It's focused on you. And we just want to know that you feel fully prepared for everything that you're saying yes to. We want to know that you feel comfortable with what's about to go on for your body and that you've thought about the things for the future. We also want to know if there's anything in you or your family members that may hinder or hurt the experience for any party involved. I actually find that donors in my psychological evaluations end up truly enjoying their session.
Hi, I'm Amy Vance, genetic counselor, and I founded Bay Area Genetic Counseling about 20 years ago. I've worked with thousands of egg donors taking and completing family histories for the process of egg donation. The reason that we do this is really just to make sure that we can get a very complete history for the donor-conceived person of all kinds of medical issues that might be running in the family. There also are some guidelines by the American Society of Reproductive Medicine that donors' family histories need to meet, but almost everyone meets those guidelines. We also want to make sure that there's no specific genetic testing that should be offered to you that specifically is based on your family history, which would be separate from carrier screening. And so the process is a very relaxed interview. I usually give people some homework before our call, asking you to talk to family members and gather some details about health conditions, major and minor medical conditions. And then when we're talking on the phone, I review your profile and the information that you've gathered, and I construct a family tree. Then I write a report that has an analysis of all the information that you've given me, and if there are any data points that would be pertinent to the health conditions in your family, then I'll put that in the report. And this information is also provided to you, and a lot of people find it very interesting to get the drawing and the information about their family history. So that's really what the genetics consult is. It's not a scary process, and thank you.
So, you're thinking about being an egg donor. I'm the last stop on your way toward understanding all the complicated aspects of the process. I'm Steve Snyder. I'm an attorney. I've been doing egg donation law for 30 years. The first and foremost advice that I have you is that you need to enter into an express written legal agreement with the recipients of your eggs. In negotiating and signing that agreement, you need independent representation by an attorney that represents only your interests. The reason you need that agreement is that parentage is established differently in most states, but in most states it is established by genetic relationship. So when you donate your egg and are genetically related to the child, there's a risk that there's some parental result that isn't intended. The contract is what sets forth the intent that you're only a donor, that the parents are the intended and legal parents, and how the structure of your relationship with them is existing. In addition, the contract can handle other aspects of the matter. It can determine what type of egg donor you are. Are you open, meaning you want to share any and all information with the intended parents from the outset and have an open relationship to exchange information about health and social aspects of the donation? Are you semi-open? You're willing to exchange health information or certain critical information, but only through a third-party intermediary like your agency or your attorney. Or do you want to do it anonymously? Do you not want the resulting children to know who or where you are? There are still anonymous donations occurring. They're less reliable given Ancestry.com and the ability of children of donation to use that genetic registry to find their genetic parents, sometimes anonymous donors. So, determine what kind you want, document it in your agreement. In addition, your agreement can determine whether you want any choice or identification of the recipients that you're donating to. Your agreement can determine what happens if embryos are created with your eggs and the recipient's sperm, but all the embryos aren't used. Do you want control or at least notice of if and when those embryos are donated on, to whom, where, and if it isn't a notice, is it perhaps a reversionary interest? Meaning if you don't use them, they're partially my genetics, I would like the opportunity to receive them back. There are many other details about donation that are covered in that contract that are necessary to make you safe and accomplish the intent you actually have. So make sure that no matter what you do, you consult with an attorney, enter into a written agreement with the recipients, and make sure, in addition to all of the information in this video, that you are fully informed.